If you wake up most mornings and the very first thing you feel, before your feet even touch the floor, is that deep, nagging ache somewhere in your lower back. If there's a burning or tingling that travels down one leg and you've been told it's just your age, just arthritis, just something you'll have to manage, or if you've been dealing with that strange weakness in your legs, that feeling like you can't trust your own body when you walk down a flight of stairs, then I need you to stay with me for the next 15 minutes, because what I'm about to share with you could genuinely change the way you understand your own pain. I'm Dr. Michael Kent, and I've been practicing medicine for over 2 decades, and in those years, I've sat across from thousands of patients, men and women in their 60s, 70s, even 80s, who were suffering from spine and nerve pain, and who had been told essentially the same 3 things. Take this painkiller, maybe get an injection, and if it gets bad enough, we'll talk about surgery. Now look, that advice isn't always wrong, but here's the thing: it is almost always incomplete. And the piece that's almost universally missing from those conversations, it has to do with what your nerves actually need to stay healthy, to heal, and to function the way they're supposed to. I want to talk to you today about a group of vitamins, 3 specific ones, that are so critical to nerve and spinal health that I genuinely believe their deficiency is contributing to the chronic pain of millions of people who have no idea this is even a factor. By the end of this video, you'll understand why your spine pain is as much a nerve problem as a structural one, what those nerves actually need to protect and repair themselves, and what practical steps you can start taking starting this week to support your body from the inside out. Now, before I get into all of that, let me tell you about a patient of mine, because this really brings everything to life. I had a patient, let's call him Raymond. Raymond was 67 years old, a retired electrician, very active his whole life, always fixing something around the house, never sat still. He came into my office about 2 years ago, and the moment he lowered himself into the chair, I could see the effort it took him. He told me he'd been dealing with shooting pain down his right leg for about 14 months. Not just discomfort, we're talking about a sharp electric sensation that would hit him without warning. He'd be standing in his garage and suddenly have to grab the workbench just to stay upright. Get this, he'd actually stopped driving because the vibration of the car would sometimes trigger it so badly he couldn't focus. Raymond had done everything he was told: physical therapy, 2 epidural steroid injections, a course of nerve pain medication. He'd even worn one of those back braces you see advertised on TV for 3 months straight. And you know what? The pain was still there, sometimes worse. When I reviewed his history and ran some additional testing, and this is where it got really interesting, we discovered something that nobody had looked for. His B12 level was critically low, not slightly below normal. We're talking about a level so depleted that it would absolutely explain the neurological symptoms he was describing. Here's what nobody had told Raymond about what was happening in his body. Your nerves don't just need a clear mechanical pathway to function. They need fuel. They need raw materials. And when those raw materials are missing, the nerves start to break down from the inside out. Let me explain exactly how that works. All right, so to understand why this happens, you need to understand something fundamental about your spine that most people were never taught. Most people think of their spine as basically a column of bones, a stack of building blocks that holds you upright and lets you move. And while that's not entirely wrong, it completely misses the most important thing your spine actually does. Here's the thing: your spine is first and foremost a communication system. Think of it less like a building column and more like the main trunk cable in a massive telephone network. One that runs every signal between your brain and literally every organ, muscle, and limb in your body. Your spinal cord, running through the center of your vertebrae, is a direct extension of your brain. And branching out between every pair of vertebrae are nerve roots that carry those signals out into your arms, your legs, your digestive system, your bladder, everywhere. So here's what actually happens when something goes wrong in your spine. First, a disc may bulge, or a bone spur may form, or the spinal canal may narrow. Any of these can compress a nerve root coming out of the spine. Then, the nerve under pressure begins to respond with inflammation. It sends distress signals. Those signals can misfire, arrive garbled, or create pain sensations in places that seem totally unrelated to your back, like the bottom of your foot, or your calf, or your big toe. Over time, and we're talking months or even years of ongoing compression and inflammation, the nerve can begin to lose its protective coating. And that is where real, lasting damage sets in. And eventually, if the nerve's structural integrity continues to erode, even after the mechanical pressure is relieved, even after a procedure or surgery, the pain and numbness may persist. Because now you have a damaged nerve, not just a compressed one. Now, most doctors focus almost entirely on the mechanical side of this, the disc, the vertebrae, the stenosis. And look, that's not wrong, but it's only half the picture. What they're often missing is what's happening at the nerve itself, specifically the health and integrity of something called the myelin sheath. You know what the real problem is? The real problem, the one that flies completely under the radar, is that while everyone's looking at the structural cause of compression, the nerves are quietly starving for the nutrients they need to maintain that protective coating. And that is the crisis I want you to understand today. So what's really accelerating the damage to your nerves and spine? It's not just the herniated disc, it's not just the bone spur. And honestly, this surprises most of my patients when I bring it up. The real culprit is a state of chronic nutritional deficiency at the nerve level, specifically a deficiency in 3 B vitamins that your nervous system cannot function without: B1, B6, and B12. And here's what shocks people when I tell them this. You don't need to have a dramatic disease or a poor diet to be severely deficient in these vitamins. You only need to be over 60, and in many cases, to be taking a handful of common medications. Let me show you exactly how this plays out. Your nerves are surrounded by a protective sheath, called the myelin sheath, that functions like the insulation on an electrical wire. It's what keeps nerve signals crisp, fast, and accurate. When myelin is healthy, pain signals are properly regulated, movement is coordinated, and sensation is normal. But when your body is depleted of B12, which is the primary raw material for myelin production, that sheath begins to thin and degrade. Signals start to misfire, pain becomes amplified, and that burning, electric shooting sensation that so many of you describe, that's exactly what a demyelinating nerve feels like. What makes this especially dangerous, and this is something I wish more doctors talked about openly, is that B12 deficiency is notoriously difficult to detect through symptoms alone because it develops slowly over years. By the time you feel it, significant nerve damage may already be underway. I see this pattern in my practice constantly. The patient has been told their MRI shows a disc problem, and yes, there may be a disc problem, but the severity of their neurological symptoms often points to something more. It points to a nervous system that's been running on empty. Now, where are these deficiencies hiding? And how does this happen in people who think they eat reasonably well? Let me walk you through each of the 3 vitamins and explain what makes them so critical and so commonly depleted. Number 1, vitamin B1, thiamine. This is the energy vitamin for your nervous system, and it's more important than most people realize. Every nerve cell in your body runs on a constant supply of energy, specifically glucose metabolism that B1 directly enables. Without adequate B1, nerve cells can't produce the energy they need to conduct signals or protect themselves from damage. Here's what happens when you're under chronic stress, and many of my patients dealing with persistent pain are under chronic stress. Your body burns through B1 rapidly. Stress hormones, particularly cortisol, accelerate B1 depletion. And when B1 drops, your nervous system feels it fast. The nerves become more sensitive to pain, inflammation increases, and the whole cascade gets worse. I'll give you a specific example. I had a patient, a 71-year-old retired teacher, very health conscious, ate well, who had been under significant stress after her husband's illness. Her back pain worsened dramatically during that period. When we tested her nutrient levels, her B1 was notably depleted. Supplementing it was part of what helped turn the corner for her. Number 2, vitamin B6, pyridoxine. Now this one might surprise you. Most people associate B6 with things like mood and sleep, but B6 is involved in over 100 enzymatic reactions in the body, and several of them are directly related to nerve function, neurotransmitter production, and the synthesis and maintenance of that myelin sheath we talked about. Look, I know it sounds overly simple, but B6 is essentially a cofactor in the process your body uses to build and repair nerve insulation. Without adequate B6, that process slows down. And here's the problem: B6 is depleted by the same things that deplete B12. Aging, stress, and a long list of common medications including birth control pills, corticosteroids, and certain blood pressure drugs. What actually happens is that without B6, the biochemical pathway that produces myelin components stalls. Your body simply doesn't have the tools it needs to run the repair process. And this is why so many people with persistent nerve pain, even people who've had successful structural procedures, continue to suffer. Number 3, vitamin B12. Cobalamin. Now this one is the most critical of the three, and the one most likely to be severely deficient in anyone over 60. Let me explain why. B12 is the linchpin of nerve health. It is directly involved in myelin production, DNA repair in nerve cells, oxygen delivery to nerve tissue through red blood cell formation, and the integrity of the spinal cord itself. Nothing in your nervous system works optimally without adequate B12. But here's something I bet you've never heard before. B12 absorption isn't just about how much B12 you eat. It depends on a protein called intrinsic factor, produced in the lining of your stomach. And as we age, the stomach produces less of it. A 60-year-old may absorb only a fraction of the B12 a 30-year-old would absorb from the exact same meal. On top of that, two of the most commonly prescribed medication classes in older adults, metformin for diabetes and proton pump inhibitors for acid reflux, are documented to further suppress B12 absorption. The result is a quiet, slow-building nutritional crisis that affects a staggering number of older adults, most of whom have never been told to check their levels. This reminds me of another patient. Let's call her Dorothy. Dorothy was 74 years old, a sharp, independent woman who had managed her type 2 diabetes well for years. She came to me because the pain and numbness in her feet had gotten so bad that she was genuinely afraid to walk at night. She told me, "Dr. Kent, I don't trust my own feet anymore." That stuck with me. Her neurologist had attributed her symptoms entirely to diabetic neuropathy. And look, diabetes absolutely does affect nerves. But when we tested her B12 levels, something that had never been done despite her being on metformin for 11 years, we found her B12 was profoundly deficient. Not borderline, severely low. And you know what the crazy part was? The metformin itself, the medication she'd taken faithfully for over a decade to protect her health, had been quietly depleting her B12 the entire time. Nobody had ever told her that was a risk. Nobody had ever checked. Once we addressed her B12 deficiency aggressively, using the right form at the right dose with proper monitoring, within about 8 weeks, Dorothy noticed a meaningful reduction in her nighttime numbness. Within 4 months, she told me she was walking through her neighborhood again in the evenings. She said to me, "I just thought that was my life now. I didn't know it could be different." That's the difference between treating only the diagnosis on paper and looking at the whole person. It's not about being dramatic, it's about being thorough. Now look, I need to be honest with you about something. B vitamin deficiency doesn't reverse overnight. These are changes that have often been building over years, and meaningful recovery takes time, consistency, and, critically, a comprehensive approach. You can't just pop a supplement and expect everything to resolve in a week. But, and this is really important, that doesn't mean meaningful improvement isn't possible. Because in my experience, when the right nutritional support is combined with the right lifestyle changes, the body has a remarkable ability to adapt, repair, and recover, even at 65, even at 75, even after years of chronic pain. So what actually works? What can you control starting this week? Let me give you a clear, practical framework, the same one I walk my patients through. All right, here's the most important principle I teach my patients, and this is something most people have genuinely never heard framed this way. Your body cannot repair what it hasn't been given the tools to repair. Not just movement, not just rest, not just a procedure, but actual raw biological material, the nutrients your nerve cells require at the cellular level. Most treatment approaches skip this step entirely and go straight to mechanical intervention. And then everybody wonders why the relief is temporary. Now, why does this matter so much? Because your spine and your nervous system are constantly in a cycle of damage and repair. Every day, compression, inflammation, and normal wear cause small amounts of nerve tissue damage. And every day, if the raw materials are present, your body works to repair that damage. It's a continuous biological negotiation. If you're nutritionally depleted, the damage consistently outpaces the repair. If you're nutritionally supported, the repair has a real chance to catch up. Let me make this really concrete for you. If you've had a herniated disc for 3 years, addressed the mechanical component through therapy or a procedure, but never addressed your B12 deficiency. You may have removed the source of compression, but left the nerve without the tools to heal itself. The damage to the myelin sheath continues accumulating. The pain persists, and everyone assumes the procedure just didn't work. This principle alone explains why some people recover fully from spine problems, while others with nearly identical MRIs continue to suffer. It's not always the structural severity. It's often the nutritional state of the nervous system underneath. Let me tell you about Walter. Walter was 63 years old when he first came to see me, a former long-haul truck driver, so his spine had genuinely taken a beating over decades of sitting and vibration. He'd had 2 separate episodes of significant back pain in his 50s, each time recovering with physical therapy. But this time, something was different. Now his daily routine looked like this, and I want you to see if this sounds familiar. Every morning, Walter would take his blood pressure medication, his acid reflux tablet, and his cholesterol drug. 3 medications all before breakfast. Then he'd have what he described as a healthy day. Reasonable food, a short walk, modest activity. He was genuinely trying. But here's what the problem was. 2 of those 3 medications he was taking had documented effects on B vitamin absorption. His proton pump inhibitor was suppressing the stomach acid he needed to release B12 from food, and one of his other medications was affecting B6 metabolism. He'd been on this combination for 6 years. His body had been flying nutritionally depleted for 6 years, slowly losing ground. So we made 3 changes. Simple ones, but powerful. First, we had his B12, B6, and B1 levels properly tested. Not just the standard labs, but the specific markers that actually reveal functional deficiency. Second, we started him on high-quality supplementation using the active, bioavailable forms of each vitamin. Methylcobalamin for B12, P5P for B6, and benfotiamine for B1. Third, we worked with his prescribing physician to review the necessity of each medication and ensure he understood the nutritional implications of long-term use. And here's what happened. Within 6 weeks, Walter noticed his sleep was improving and the nighttime aching in his legs had softened. By 3 months, the electric sensation down his right leg was significantly less frequent. By 5 months, he told me he'd gone back to gardening, something he'd given up 2 years earlier because bending would send pain shooting down his leg. Walter told me, "I kept waiting for something major to change. I didn't expect it to be something as basic as what I was missing in my blood." See, that's the difference between chasing the symptom and addressing the system. It's not about miracle cures, it's about giving your body what it actually needs to do its job. All right, here's your complete action plan, 5 steps that will give your nervous system and spine a genuine fighting chance. Now, I'm going to go through these one by one, and I want you to pay close attention because these are the same steps I walk my own patients through in the office. Step number 1, get the right labs done. Here's what you do. Ask your doctor for a comprehensive nutritional panel that includes serum B12, active B12, holotranscobalamin, methylmalonic acid, and homocysteine. These 4 markers together give you a much clearer picture of true B12 status than a standard B12 test alone. Now, the science behind this is straightforward. Serum B12 can look normal while the body is functionally deficient at the cellular level. Methylmalonic acid and homocysteine are metabolic byproducts that rise when B12 isn't doing its job, even when the standard number looks okay. One mistake I see all the time, people get told their B12 is fine based only on a basic serum test, and they take that as a green light and move on. Don't make that mistake. Ask specifically for methylmalonic acid and homocysteine. Your doctor will understand why. Step number 2, supplement with the right forms. Look, I know this might sound unnecessarily complicated, but trust me on this, the form of the vitamin matters enormously, especially for people over 60. For B12, use methylcobalamin, not cyanocobalamin, which is the cheap synthetic form found in most drugstore supplements. Methylcobalamin is the form your body actually uses at the nerve level, and research suggests it has specific benefits for nerve repair and regeneration. For B6, use pyridoxal 5-phosphate, or P5P, the active coenzyme form that your body can use directly without requiring conversion. This is particularly important for older adults whose enzyme activity may be reduced. For B1, consider benfotiamine, a fat-soluble form of thiamine that crosses cell membranes more effectively than standard thiamine and that has shown specific benefits in research on nerve-related pain. But here's a warning, and this is important. More is not always better. Excessive B6 supplementation in particular can paradoxically cause nerve damage if taken in very high doses over extended periods. Work with your healthcare provider to identify appropriate dosing for your specific situation. Step number 3, rebuild through anti-inflammatory nutrition. Now, this is where food comes in as actual medicine. Your nervous system needs an environment of reduced inflammation to heal. And what you eat every single day either feeds that inflammation or fights it. The big ones to add: omega-3 fatty acids from fatty fish, walnuts, and flaxseed, leafy greens rich in B vitamins and antioxidants, colorful vegetables, and adequate protein for tissue repair. These are the raw materials of nerve health. What to reduce: processed and packaged foods, refined sugars, excessive alcohol, and trans fats. These compounds actively promote the kind of systemic inflammation that degrades nerve tissue over time. I tell my patients, every meal is either a repair crew or a demolition team. You get to choose which one shows up. Step number 4, move, but move intelligently. You don't need aggressive exercise. Honestly, high impact or overly strenuous activity can actually make things worse in an already irritated spine. What your nervous system and spine really need is gentle, consistent, purposeful movement. Walking, even 20 minutes a day, improves circulation to the spinal discs and nerve roots, reduces inflammatory cytokines, and maintains the muscle support that takes load off the spine. Swimming, gentle stretching, and targeted therapeutic exercises prescribed by a physical therapist are all excellent options. I tell my patients you don't have to train for anything. You just have to move every day. Consistent, gentle movement is medicine when you do it right. Step number 5, audit your medications with your doctor. This one is underutilized and incredibly important. If you're taking any long-term medications, especially metformin, proton pump inhibitors, diuretics, or certain blood pressure medications, have a conversation with your prescribing physician specifically about their impact on B vitamin levels. This isn't about stopping medications. Please do not stop any medication without medical guidance. This is about being informed. Knowing that your acid reflux pill may be reducing your B12 absorption over time is information that allows you and your doctor to proactively monitor your levels and supplement appropriately. That's the kind of whole system thinking that produces real outcomes. All right, before you start implementing these steps, there are some critical things you need to hear. First, do not attempt to diagnose yourself based on symptoms alone. Many of the symptoms associated with B vitamin deficiency, tingling, numbness, weakness, fatigue, also overlap with other conditions that require specific diagnosis and treatment. A symptom pattern alone is not sufficient to determine the cause. Please get properly tested. I've had patients come to me after spending months self-supplementing with high-dose B6 based on something they read online, only to develop a condition called sensory neuropathy, which is, ironically, a form of nerve damage caused by B6 toxicity. The supplement intended to help had caused new harm. Don't make that mistake. Second, if you've been dealing with worsening neurological symptoms, progressively increasing weakness, loss of bowel or bladder control, or rapidly spreading numbness, this is especially important to have evaluated urgently. These can be signs of conditions that require immediate medical attention and cannot wait for a nutritional protocol. Look, the key is to work collaboratively with your healthcare provider. Never self-prescribe at high doses without monitoring. Always report new or worsening symptoms promptly, and be an active, informed participant in your own care. That's the balanced approach that actually produces results. Let me share one more story with you because this really shows you what's possible. I had a patient, we'll call her Beverly. Beverly was 69 when she came to see me, and she was in a place that I've seen too many times, a quiet kind of surrender. Not dramatic despair, just a gradual acceptance that her life had gotten smaller. She could no longer attend her grandchildren's weekend soccer games because standing on the sidelines for more than 20 minutes triggered such intense lumbar pain that she'd be incapacitated for the rest of the day. She'd stopped going on her church's monthly group walks. She'd reorganized her entire kitchen so she didn't have to bend down. She was 70% through her life, and she was already contracting. Every physician she'd seen had confirmed the structural findings: moderate disc degeneration at L4-L5, mild facet arthropathy, and told her this was the trajectory of her condition. One had told her, "At your age, you manage it. You don't really recover." When we looked at her full picture, nutritional status, lifestyle, medication history, inflammatory markers, the gaps were significant. Her B12 was functionally deficient. Her diet was low in anti-inflammatory nutrients. She'd been sedentary for nearly 2 years out of fear of triggering pain. And she was under enormous chronic stress caring for an aging parent. It didn't happen overnight. It took a consistent 4 months of nutritional rehabilitation, a graduated movement program, stress support, and close monitoring. But gradually, the pain became less unpredictable, then less frequent, and eventually, Beverly told me she'd attended 2 of her grandson's soccer games in a row, standing the full time. She told me recently, "Nobody ever told me that what I was eating and what I was missing could be part of what was keeping me stuck. I thought it was just my body failing me. Turns out my body just needed what it was missing." And that is what this is really about. Not just reducing a number on a pain scale, but reclaiming the actual life you want to live. The soccer games, the morning walks, the kitchen you navigate freely. That's why I do what I do. Look, this isn't just about back pain. It's so much bigger than that. It's about being able to move through your life with confidence. It's about being present, physically, not just mentally, for the people and moments that matter to you. It's about not having your world get smaller year by year because your nervous system is deteriorating faster than it needs to. Here's what I've seen happen when nerve and spine health is neglected without addressing the nutritional foundation. The pain becomes more constant, mobility decreases, sleep worsens, and with reduced sleep and mobility, mood suffers, social engagement drops, and independence erodes. This leads to a cascade that affects not just physical health, but cognitive health, emotional well-being, and quality of life in ways that are deeply interconnected. And honestly, I've watched too many patients in their late 60s and 70s lose years of good living. Not because their conditions were untreatable, but because the underlying nutritional contributors were never investigated and the window for meaningful intervention was missed. That's why I'm making this video. That's why I want you to understand this now, not 5 years from now when the damage is deeper and the recovery longer. All right, here's what I want you to do, and I'm being specific here. Over the next 21 days, 1. Request a comprehensive B vitamin panel from your doctor. Specifically ask for methylmalonic acid and homocysteine, not just a standard B12 reading. Go prepared to ask for it. 2. Review your current medications with your pharmacist or physician and ask directly, "Do any of these affect my B vitamin absorption or metabolism?" Write down the answer. 3. Make one specific dietary addition each week. Week 1, add a fatty fish meal twice. Week 2, add a daily leafy green. Week 3, reduce your most significant source of processed sugar. 4, start a daily 20-minute walk. Not intense, not rushed, just consistent movement that tells your nervous system it's supported, not stationary. 5, begin a simple sleep log. Note what time you fall asleep, whether you wake in the night, and how rested you feel. Your nervous system repairs during deep sleep, and poor sleep quality is both a cause and a consequence of nerve pain. Now here's what I want you to track over those 21 days. Pay attention to your morning pain level before you get out of bed, the frequency of your worst nerve pain episodes, and your energy in the afternoon. These are 3 very telling indicators. Most of my patients notice some improvement in their worst pain frequency, better morning mobility, and more consistent energy within that time frame when they follow through consistently. Look, the goal here isn't perfection. The goal is consistent forward motion. Even noticing that your worst episodes are slightly less frequent tells you the system is responding. That's meaningful. That's data. That's hope. All right, let me wrap this up with some straight talk. If anyone comes to you promising a supplement that will cure your spine problems in 30 days, be very skeptical. Nerve and spine health doesn't work like that. There are no shortcuts, and anyone telling you otherwise is after your money, not your health. But if someone tells you that the damage is done, that your age has determined your fate, and that managing your decline is the best you can hope for, they're selling you something just as dishonest. Here's the truth. Your body, at any age, is continuously working to maintain and repair itself. The spine and nervous system are not static. They're dynamic biological systems that respond to the environment you create for them, the nutrients you provide, the movement you give them, the stress you manage, the sleep you prioritize. Nerve deficiency develops over years of gradual depletion. So yeah, it makes sense that recovery requires time, patience, and consistency. Not a week, not a pill, but a sustained commitment to giving your nervous system what it has been missing. But here's what matters most. It is absolutely possible to live with significantly less pain, more mobility, and more confidence than you have right now. I've watched it happen again and again in real people with real diagnoses, and you deserve to be one of them. Start by getting your levels checked. Talk to your doctor, ask the right questions, and then take one meaningful step today, not tomorrow, today, toward the broader changes that will support your nervous system for years to come. Remember, Your nervous system is always listening to what you give it. Start giving it what it needs. I'm Dr. Michael Kent. Thanks for watching, and I'll see you in the next one.